Let's discuss diagnosis according to the Sangfu organ patterns, the heart imbalances, pathology part 2. As stated, a deficiency of heart yin and heart blood can manifest with insomnia because the shen is not anchored at night, resulting in person being awake and conscious. Excess heat in the heart, such as when there is heart fire or phlegm heat, can also result in insomnia. In these situations, even though heart yin and blood are not weak, they are not able to root the shen because it is being agitated by the excess heat. The heart is responsible for and control communication and contact with others. If there is an excessive heat, the person can become too communicative. They will be too open. These are the people who share their whole life story with complete strangers without the stranger even having shown any particular interest in hearing it. In the clinic, these clients can be difficult to interview because they talk too much and give you far too many details without you asking for them. They will usually also talk more quickly because heat overactivates the shen, resulting in a cascade of thoughts. The opposite of these patients are people who are uncommunicative and taciturn. They can also be difficult in clinical setting because it can be a problem drawing information out of them. This is usually a manifestation of the heart chi stagnating or being blocked. Phlegm can also obscure the shen by enshrouding it in a blanket or lying like a mist around it. These people are not completely present. It can be difficult to create and maintain contact with them. Their communication can be a bit confused and their voice may sound slurred. If the phlegm is very concentrated and the shen can become so obscure that they talk nonsense, saying one thing but meaning something completely different, or they are completely enclosed in their own world and talk to themselves. By the blocking and shrouding of their shen will mean that their comprehension is impeded and they will also have difficulty concentrating. The memory and concentration will also be affected by other heart imbalances. If the shen lacks nourishment, for example, if there is heart blood deficiency, the memory and concentration will be poor. It can also result in a poor concentration, although the dynamics are completely different. Heat will agitate shen, so the mind is easily distracted, and there will be too many thoughts arising in the head, making it difficult to maintain focus and concentrate on one thing at a time. The activity and agitation will also mean that their memory will often be poor because the information never had a chance to settle and thereby be stored. Phlegm blocking the shen will also result in difficulty concentrating. There is a mental fog and the person will have difficulty thinking clearly and comprehending what is going on around them. Shen manifests in the eyes. This means that when the shen is affected, it is possible to observe deviations here. Ideally, when the shen is in balance, the eyes will be clear and bright. Balance. There will be good eye contact between you and the patient. Heat agitates shen and can cause person eyes to dart about and they can have difficulty maintaining eye contact. When it is there, the eye contact will be clear and even intense. A person who is heart chi deficient will find it difficult to maintain eye contact, but this will be due to shyness or nervousness, and their eyes will lack vitality and sparkle. Phlegm can cause the eyes to be dull and matte. The person's shen cannot shine through the mist. When there is a heart chi stagnation, it is as if the person's vision becomes introverted and does not extend outward from their eyes. It is as if they lack vision and only look inwards towards themselves. When there is excess heat, the opposite happens and the eyes can be very intense. One of Shen's function is to ensure that we conform to society around us and that our behavior and responses are normal. If Shen is agitated by heat or blocked by phlegm, this function is disturbed. This can result in a person saying and doing things that other people think are strange or weird. Their appearance may also seem peculiar to others. People whose shen is disturbed can often be recognized by their attire, their hair, and their general appearance. Their clothes can be gaudy, discordant, or just muddled. It is important, however, to remember that what seems abnormal to many people can be quite normal in a particular subculture. In this case, the person's shen is in a fine balance. They have just adopted different standards. A person's shen is an individual refraction of the universal shen. If their shen is in harmony, they can have a fundamental sense of belonging, a sense of tranquility and security. When shen is agitated, blocked, or undernourished, the person can lose this sensation and they can feel unease, anxiety, or fundamental loneliness. A person who is heart chi deficient and whose shen is undernourished can have low self-esteem and lack self-confidence. The tongue is controlled by the heart. If there is heart fire, the tongue will not just be red as is usual in fire conditions, but there can also be ulcers and sores on the tongue. The difference between these ulcers and those seen in stomach and spleen imbalance is that when there is heart fire, the ulcers will be triggered by or aggravated by stress or emotional pressure. When there is stomach and spleen imbalance, the ulcers are related to diet. Furthermore, the ulcers will be more red and elevated when there is heart fire. The tongue is also used in communication with others. As explained above, the heart has a great influence on this communication and on our speech. Heart imbalances can also affect the tongue in other ways. Stuttering, stammering can be due to heart chi being disrupted, meaning the heart loses control of the tongue. Heart fire can manifest with a bitter or metallic taste in the mouth in the morning. When there is liver fire, the bitter or metallic taste will be experienced throughout the day. Heart is nourished by and manifests with joy. If the heart is chi deficient or if there is chi stagnation, the person can seem doleful, unhappy, and lacking in vitality. The voice should also have vitality. This is not dissimilar to the tongue, pulse, skin, and so on. This should have the quality of shen, that is a quality of vitality. The same is true of the voice, but there are not the same connotations. When there are deficient conditions or stagnations in the heart, the voice will lack a certain quality. This quality isn't volume and it isn't necessarily joy, but it is related more to movement. The voice should vary and change as they talk, especially as the subject area changes. This reflects the natural movement of the shen. The voice should not be stuck in a certain gear. No sound or emotion in the voice is wrong or inappropriate. It can only be inappropriate to what is being said or to the conversation in general. In the same way that the pulse should have shen, so should the voice. When the pulse is soft yet firm and solid and is rhythmic in its beating, it tells us about the quality of the heart. The voice should have an even flow and not be stuttering or confused. Its tone should go up and down and it should have the sound of joy and happiness in it. If there is no joy, that is, if heart, chi, and shen are either black or undernourished, there will be a flatness and may be even a tone of sadness in the voice. On the other hand, if there is too much heat in the heart, there can be too much of these qualities of joy and happiness. The voice can be unnaturally glad. This is the life and soul of partly voice. Here, the voice will often be voluble and accompanied by too much laughter, and the person can seem elated and unnaturally happy. Also, there will often be too many and sometimes inappropriate jokes. It may manifest with a constant need to create laughter by repeatedly telling funny stories and making jokes. All this indicates that there is too much heat in the heart. Heart gain deficiency heat will though result in a voice that is not voluble, and the person will have more of a nervous laugh or giggle while talking. There may be a short nervous laugh that ends their sentences like a sort of inappropriate punctuation mark. Although the heart has no direct influence on physiology of fluids, it can nevertheless be involved in urinary imbalances, as well as urine becoming dark and odorous when there is heat conditions in general. Heart fire can drain down to the urinary bladder via its partner organ, the small intestine. This can result in a dark urine that may contain blood and a painful or burning sensation on urination. General symptoms and signs of heart imbalances. There is palpitation, restlessness and mental agitation, sleep disturbances, disturbances, mental emotional symptoms, changes to the tip of the tongue. Thank you for your attention.